Hi, and welcome to InFocus. This is Jabbar Lubaidi. The coronavirus does not necessarily, by its nature, discriminate among people, does not choose who to infect or not to infect. In fact, it infected people of high rank in the political arena, such as the Prime Minister of the United Kingdom and the former Prime Minister of Libya, who passed away in Cairo, Egypt, because of the COVID-19. It does and it did infect rich and poor people, young and elderly people throughout the world. However, the coronavirus may find, and in fact has found, the softer targets in various social, cultural, and economic environments in the United States. Although we don't have enough data and information about the coronavirus, nevertheless, the early available data shows that the coronavirus disproportionately ravages the people of the African American and Latino communities in the United States. We don't have information about other racial and ethnic groups, which I'm sure we're going to have in a very near future. We'll have enough data and information to talk about. The CDC, Centers for Disease Control and Prevention, estimated that 33% of the hospitalized with the COVID-19 are American Africans. The majority of Black counties have about 6 times the number of fatalities than the majority white counties. Why is the situation is so different between people of color and the white population, for example? Are there socio-political, economic, and cultural, and probably some discrepancies in the accessibility to the health system in the country, which brought this reality to the surface? With me in the studio, Dr. Diana Fox, Professor of Anthropology and the Chairperson of the Anthropology of Bridgewater State University, and Dr. Daniel Lampo, Professor of Economy at the Economics Department at Bridgewater State University, to talk about these issues. So you heard the news, and you heard my intro. Diana, are you comfortable with the situation?
No, not at all. It's absolutely untenable and deeply distressing in how the national government in particular has responded or not responded. There are stratifications by class, race, ability, queerness, gender, immigration status, prisoners. All kinds of inequalities are exacerbated by the conditions that are spreading the virus. The virus itself, as you said, is not discriminatory, but how people are responding to the virus because of underlying conditions of inequality are very much discriminatory. And those conditions are being exacerbated by the lack of attention to those who need assistance the most.
Daniel, what's your thinking? What's your interpretation to this?
Well, I think, as you said, this isn't going to discriminate against people based on the social constructs, race, and these other ideas. I suspect it's really going after poor people. And because poor people tend to have a large percentage of the population being non-white, when you look at the data, that's what you see. So I'm sure if what I would love to see is information on the income range of those people who are being afflicted by this. And I suspect what you'll find is that it's really disproportionate based on your income, right, and your socioeconomic status, not so much on the color of your skin.
Well, but I would add that I was reading an article by an epidemiologist, Kamara Jones, who worked with the Centers for Disease Control and Prevention, and she studied racial bias in the medical system. And she said that the virus is an equal opportunity virus, but the disease is not an equal opportunity disease. People who are poor, as you noted, Dan, have been historically disenfranchised. Their communities are in food deserts. Hospitals are not well distributed or supplied. So historical practices of disenfranchisement, which are continuing today, discrimination and marginalization are revealing these structural inequalities.
Structural inequality in terms of the health system or the social aspect of the whole thing, or the cultural?
Well, yes. I mean, poor people who are disproportionately people of color, because of historical exclusions that continue today, have increased risk factors. So asthma, for example, which is an increased risk factor, exists in large part because of housing structures and areas where there are toxic waste dumps, environmental racism, people who have the inability to gain access to healthy food. All of these are conditions that exist geographically that are the result of historical inequalities distributed across race, ethnicity.
So Danielle, do we have some data about this economics discrepancies in terms of, as Diana mentioned, and among poor communities and underserved, underprivileged communities?
Well, yeah, there's a lot of data. 538 has a lot of data on it, and it was interesting. They did a study of 2 zip codes. Not that I remember the names. So one was Elmwood, the other was Parkport, something like that. But anyways, one was the poorest zip code in New York, and the other was the wealthiest. And the income disparities were remarkable. The poor neighborhood zip code had 56% of the median income for New York, and the rich one was, I think, 30 or 40% higher, $120,000 a year. But then that has implications for the disease, because if you're poor, your housing is going to look different than if you're not as poor. So housing in economics is what we call a normal good. The more income you have, the more of it you buy. So if you're wealthy, you can live in a relatively large space and you can get away from each other. You probably don't have intergenerational family living situations. There's a whole slew of ways that you can practice social distancing. On the other hand, if you are lower income, you're going to occupy more people in less space, which means social distancing becomes virtually impossible. You also have more intergenerational living situations. Hence, young people who are probably essential workers are going out, being exposed to the virus, coming home, and then the other members of the family, grandparents, are catching the disease, and then it runs its course. So yeah, economics is huge in this, and the data is just, it's not surprising, and I guess that's what's disturbing. I wasn't surprised when I heard the numbers come out.
And,
But
and
it's doing what it does.
interesting point you mentioned about the housing and the space. So how critical is it for understanding community risk in terms of the space and the interrelation, the communication in this very limited space, and how then making the decision about community mitigation, including social distancing as we do now, and other strategic healthcare resources, allocations. How can that be distributed evenly, and also how we can mitigate the situation? Both of you, anyone can jump to this question.
Can I just add one point about, in addition to the problems, I think this is also, it's an issue of intersectionality. So poverty, race, ethnicity, gender, sexuality, all these things combine. So for example, one of the things that we're hearing a lot of now is that rates of domestic violence are on the rise. We don't yet have full statistics or information, but when people are enclosed in spaces with those who are controlling, domineering, violent, alcohol consumption going up in small spaces where, and there's an inability to reach those services, hotlines, for example, domestic violence hotlines, or for people to leave those spaces and go to shelters which don't have social distancing, then people are trapped, children and victims of in abusive situations, along with women and men who are as well, who are victims of domestic violence, although women are at higher risk. So this is also a problem. So the kinds of services that are needed, the kind of outreach that is needed, has to take place on multiple levels. And so I would say that within the communities where there's crowding, where there's high densities of people, where there's underserved populations in terms of access to medical resources, there have to be emergency units that establish spaces for hospital care. The way that took place during the Ebola epidemic in parts of Africa, where emergency hospital spaces were created. Some of that is starting to happen, but because the president hasn't authorized the full Defense Authorization Act, the resources are not being directed towards producing the mass amounts of care products, and such as face masks and gloves and cleaning supplies that industry should be involved in and distributing freely to people who are in dire need.
So Danielle, going back to what you just mentioned about the space and also its relation to the status, the economic status, and what actually Diana also illustrated. So is this a problem just, or those people are entitled to this virus, if I may say, because their economic status and their social structure is different from those who can afford, and then they are, of course, in a very population density is a factor there. And so again, to my previous question, how are we going to mitigate, and who is responsible to carry this really duty? Because this is a social and political issue, and we need to save our community from people of color.
Well, I think that the horror of the situation is that this is a song that's been written since the inception of this country. It's always the poor who bear the cost. Look at our armed services. We have an economic draft, essentially. I won't send my kids to the service. You probably won't send your, maybe you will, maybe you won't. It's not solely about that, but most of the people I meet who decide that that's a good option are people who are at a lower rung on the economic ladder. The same thing with the housing, with the crowding. Look at Chelsea. I don't know if you've been listening to the stories about Chelsea, but they're blowing up over there. They got infection rates comparable to New York at this point. And why? It's the most densely populated jurisdiction in Massachusetts. It's majority Latino, but really what it is, it's just a really relatively poor area where people are stacked up on top of each other. So you can have all these great pronouncements. They can't do anything about it. They probably got to go to work. If they don't go to work, they'll lose their job, they'll be fired. And then what? They become homeless. They fight with their landlords. They move in with more family members. So it's a systemic issue, Jabbar, and I don't think you can fix it now. You can begin to try to mitigate it for the next calamity that happens if you have the will to do so. But I myself am skeptical of the American will to change the situation, because it's been this situation. It's been designed like this, and we're just watching the fruits be born in this pandemic.
Designed by whom?
The United States government, the general population. I mean, you know, when FDR did the New Deal, he carved out lots of things, particularly not so he didn't benefit the minority populations. And just look at the mortgage, the housing situation in our country. Those housing was subsidized for many, many years, with the explicit exception of allowing those subsidies to go to people of color. I mean, that's insanity. So you've created the situation. That's why you see things where the African-American community in Boston has a wealth of what? Net wealth of $5, $20, not even $20. I don't know if you've seen those studies. It's absolutely outrageous. But they don't own housing. You know, not me personally, I'm a special case. My grandfather was an interesting guy. But a lot of these people never had a chance to buy housing in the 50s, in the 40s.
Right. They were purposely excluded from.
That's right.
Yeah. I mean, I think so. It's part political and legal, and it's also a product, I think, of late capitalism, the growing wealth inequality. I think historically, in the past, when there have been pandemics, in the first Black Plague, for example, there was some redistribution of wealth following in the first 100, 150 years after that, because the extremely wealthy lost a lot of money. So there's an opportunity to reorganize the distribution of wealth, but over time, I think that the wealthy have learned how not to do that. And we see in terms of how the presidential race is playing out, how with Bernie Sanders withdrawing and his inability to muster the votes that were needed for his economic revolution, we see these structures are potentially entrenched. So it depends on how long this goes on. If the wealthy lose significant amounts of money over time, then they may, and lots of people die, then you'll have fewer workers and their labor will be more valuable. So their cost, their hourly wages, there may be incentive to increase the hourly wages. But if the numbers, so it's a kind of ironic situation. If we want to contain the numbers of deaths and we want the situation to end quickly, but at the same time, those are conditions that will just lead to the re-establishment of the hierarchy of the unequal distribution of wealth.
You know, based on the information available on the data, probably you have heard about this. So I'll give you an example. In Louisiana, African Americans make up 32% of the population and account for 70% of coronavirus deaths. Maryland, African Americans make up 31% of the population and account for 52% of coronavirus deaths. Michigan, I think Michigan, it's only 14% of the population in the state account for 41 of coronavirus deaths. This is what the media have been reporting to us, and this is what the available. But so it is really is an issue, and I think so far I didn't hear any move from probably the federal government or the state. However, I have to give the mayor of Boston credit, because he said this is unacceptable, and he wants to kind of come up with a remedy for that.
Emergency relief services have to be directed at the communities that are the hardest hit. And the government has to, I mean, $1,200, what's that going to do? Nothing. I mean, that's pathetic. You know, we also have to look at how the taxes are distributed, and look at the priorities. The United Nations is calling on a ceasefire around the world now, but look at the percentage of our GDP that goes to the Pentagon.
Tanya?
Percentage goes to healthcare. You know, and how many people, and how the Republicans have chipped away at the Affordable Care Act, you know, over the last 4 years. So more people have a lack of access to health care. So, I mean, I think we know what to do. We have the solutions, but there's not the political will, and the Republicans are controlling the Senate now, and Mitch McConnell. I think it's a political issue. The same way that hunger is a political issue. We have the resources, we have the know-how.
Dania?
And so it's very distressing.
I absolutely agree. I think these problems are not novel, no pun intended. I mean, they've been with us.
They are not new, yeah.
But no one seems to be able to fix it somehow. We can't somehow fix Flint, Michigan, and their water situation. That's insanity. You know, in the end, we have to admit that people don't care. Maybe it's a bad look to have these things being talked about out loud, but the truth of the matter is that it never gets fixed. Second-class education for people of color never gets fixed. Police brutality never gets fixed. Go and watch TV shows from the 1960s with black people. And what are they talking about? They're talking about the police shooting them. The Black Panthers came from the police shooting black people. That was a while ago. If it was really a problem that needed to be fixed, it would have been fixed. But the powers that be in our society are comfortable with it. We might not like it because we're on the wrong side of it. But the ones who get to make the decisions, the ones who actually wield power, in my opinion, it must look pretty good to them because they're not doing anything about it.
Yeah, and the hope that I have is for civil society organizations at this point, until we have a new power structure, until we have the current president removed, until we flip the Senate. The hope for survival and for mitigation of circumstances resides with civil society organizations, activism, and the governors. The governors in many states are doing, and many mayors are doing what they can, given the limited resources that they have.
I mean, so we heard that the solutions are there solutions, or the solution have been ignored, or solution actually have not been introduced. I mean, so what are the solutions? I mean, I ask you as economist and also as expert and also as educator, how we can do this without, politicizing the issues?
Well, I don't know how you do it without politicizing it. You need a redistribution of the benefits of society.
Okay.
You need for my wealth and education not to determine so absolutely the chances of my kids to succeed in this society.
Yeah.
You need for our population to see us all as human beings and to care. If there's someone dying out there, It matters. It's a disaster. It's a calamity, and no one loves their kids more than someone else. If we just saw, I mean, it's Easter, right? And for all my Christian brothers and sisters out there, the point, Jesus said it, y'all gotta love each other. We gotta love each other and really honestly care and not accept the fact that Flint, Michigan doesn't have good water, or that the schools in Roxbury in some neighborhoods are absolutely terrible. How can that be? Or infant mortality rates in the South are so out of control for black families. These are not acceptable. And this special case that came up exasperates it, but it's just showing us the problems that we've had all along that frankly we've ignored.
Oh, but I have to ask you this question. I know Diana went. How about your students?
What about them?
I mean, how they are faring with this situation?
Well, it was something I was going to bring up. I think the university should really take a look and see how our kids are doing, because some of our students, no doubt, are relatively poor. I mean, they're online, they're doing their job, but I don't know what their struggles are. I've had a couple since the school went into online situation who told me they've had family members die, but they haven't been explicit about it, and I don't know what that means.
Yeah, because of privacy issue, but I can tell you the universities, they have a lot of task forces, and they are working on different issues, and they are aware of this. I mean, I'm positive about it, because they know they would like to help our students and make sure that they are concerned about their well-being and their families, and so it is there. I mean, if your students they need some help, they should be able to contact some of these committees and some of the contact appointed people.
That would be good.
Are on top of this, and I would like to hear a word from you too. I mean, the response comes, of course, most of the health providers and nurses, doctors, are really also from different communities, racially speaking. So, I mean, we should always thank them too.
Yes,
I have a word from you, please.
Yeah, thank you for putting it all on the line, because in the end, no one knows what's coming, and there's a lot of bravery happening out there.
Yeah, I mean, as you mentioned, our nurses, doctors, police officer, firefighters, those people who work in grocery stores, also they put them online just to serve us. And as you really mentioned, we have to provide love. We love each other, and I think we can pull ourselves out of this virus healthy and stronger if we can work together and take care of each other, because we have to go back to our humanity, as you said.
I agree.
Thank you, Doctor. I appreciate that. And thank you for watching InFocus, and we'll see you next week.